So thank you so much. I think we move to the next talk, my favorite topic, cataract with corneal opacity, by none other than Dr. B P Kashyap.
Thank you, ma'am. First of all, I'm so grateful to Dr. Rajesh and the whole team, Dr. Tityal, sir, Namrata madam, to have given me this opportunity. My topic is very simple, very popular, very, everybody has this problem. So I'll be talking about the cataract with corneal opacity. Please see that the surgery depends, the planning of the surgery depends on the grade of the opacity, whether it's a nebula grade, whether it's a macular or leucoma grade. And where is the site? Where is the opacity? Is it central? And normal site where one is used to do the chopping of the nucleus. That is very important. If that is opaque, you have tough time to do the cataract surgery. And sometimes there is total opacity. In our region, there are a lot of people who have total corneal opacity and then they require corneal grafting. So there are expected difficulties in certain procedures like while doing rhexis. So while doing rhexis, if there is opacity is hindering your view, what do you do? And chopping and dividing the nucleus, whether you do open sky or a method while doing followed by PK or do in a closed chamber. And many times there's no procedure is possible without removing opacity. So I'll be showing some videos on these lines. So the first case is, this is a total corneal opacity after putting this fluorescein, removing the corneal button. We are doing rhexis on an open sky method. Mind you, this is not very easy. It is trypan blue assisted. And after completing this with a hydro procedure, we deliver the nucleus very, very slowly and taking care that the vitreous, there is no upthrust of the vitreous. Very nice and calm and quiet eye, and then do irrigation aspiration, again open sky method. And we put the rigid IOL, and this is a rigid IOL, and the trailing haptic is tucked in. Sometimes we put a foldable IOL, sometimes we use different method. I'll come to that. And then you put back the corneal button after peripheral buttonhole iridectomy. I hope everybody is having a good view.
Perfect, perfect. Very nice.
Yeah, sometimes we have to put the BCL, that is bandage contact lenses. So this is the second case. Again, the total corneal opacity. After putting all the marks and fingering ring, there is an open sky method. Now this goes haywire. So we have, from the other end, we started doing a can opener type rhexis. And hydro procedure. Now look at that. This is not a smooth delivery of the nucleus. So we want to save the vitreous, remove it, and the first thing we do is put the corneal button as early as possible. There are cortical matters at the moment. And after putting the corneal buttons, we remove 1 or 2 stitches and put the IOL after that. Again, the trailing haptic is tucked in. The stitches taken, and then some amount of the eye is done. Remove cortical matters are removed. Lens is centered. And knots are buried. Third case, some amount of capsule is visible. We are removing the pupillary membranes, and then endolimiter assisted rhexis is being done in a closed chamber. So you can move the endolite wherever it gives you a good view. And once that is done, trephination is done, corneal button removed and lens delivered. And this is a 3-piece IOL, and this is dialed in. You have to be slow, smooth, and very, very soft. And once the lens is inside, you put the corneal button, put the stitches. Fourth case, total corneal opacity, put in the Organised ring. This was a one-eyed patient. We did a mercy operation on this case, and there was a lot of posterior synechia. There was thickening of the capsule and fibrotic membrane. We were not able to remove all those. So we put the lens inside, tucked in, rigid IOL, and did the pupillary papiloplasty. With this, the patient was able to move around, and the patient is on follow-up. This is the next case. The lens is visible, and we are doing rhexis, trypan blue assisted rhexis, without the help of endolite. Lens delivered. Open sky, eye done. Cortical removal. And we are dialing in the rigid IOL. This is dialed in. I use the hole. When I dial it, I feel that I'm really in the catheter bag. And then corneal button kept over it, and then stitches are given after peripheral buttonhole iridectomy. In the last case, I thought I'll be able to manage everything, but I felt that I was unable to do the phacoemulsification. So I put the chandelier light and completed the phacoemulsification. Cut it short. And after completion of the surgery, no stitches is required and it goes by itself. So thank you very much. I invite any questions for me.
Thank you so much, Dr. Kashyap sir. I think those were fantastic sets of videos, wonderful keratoplasties with cataract surgeries, as well as phacoemulsification or cataract surgery in the presence of corneal haze without corneal transplantation procedure.